Von Willebrand disease, or VWD, is a genetic bleeding disorder. It affects about 1% of the population, making it the most common bleeding disorder worldwide. VWD often goes undiagnosed due to its varied and often subtle symptoms. This can lead to delayed or inadequate treatment, potentially resulting in serious health complications. VWD is caused by a deficiency or defect in von Willebrand factor, or VWF, a protein essential for blood clotting. It acts like a glue, binding platelets together to form a plug that stops bleeding. Often passed down through families, VWD can also develop spontaneously due to gene mutations. Understanding the inheritance pattern is crucial for identifying individuals and families at risk. Early diagnosis and appropriate management are vital to prevent and treat bleeding episodes. This can significantly improve the quality of life for individuals living with VWD. The impact of VWD extends beyond just excessive bleeding. It can significantly affect an individual's mental and emotional well-being. Living with the fear of unexpected bleeding episodes can be stressful and anxiety-provoking. Therefore, a comprehensive approach to VWD care must address not only the physical symptoms but also the psychological and social aspects of the condition. The clinical presentation of VWD is highly variable, ranging from mild to severe. This spectrum of symptoms often makes diagnosis challenging. Some individuals may experience only mild bleeding, such as easy bruising or frequent nosebleeds. Others may have more severe bleeding episodes requiring medical intervention. One of the most common signs of VWD is mucocutaneous bleeding. This includes nosebleeds, gum bleeding, and heavy menstrual bleeding in women. These symptoms are often mistaken for other common conditions, leading to delays in diagnosis. Gastrointestinal bleeding is another possible manifestation of VWD. Prolonged bleeding after surgery or trauma is a red flag for VWD. This can range from excessive bleeding after a minor cut to life-threatening hemorrhage after a major surgery. Early identification and treatment are crucial in these situations to prevent complications. The variability in symptoms underscores the need for a high index of suspicion in individuals presenting with a history of abnormal bleeding. Diagnosing VWD involves a combination of a thorough medical history, physical examination, and specialized laboratory tests. These tests aim to assess the quantity and function of VWF in the blood. The initial step often involves a bleeding time test. This measures how long it takes for bleeding to stop from a small puncture wound. A prolonged bleeding time can suggest VWD but requires further investigation. Quantitative VWF assays measure the amount of VWF present in the blood. Low levels of VWF are indicative of VWD. However, VWF levels can fluctuate, so repeat testing might be necessary. Qualitative tests such as VWF activity assays evaluate the function of VWF. These tests measure how well VWF binds to platelets and promotes clotting. Defects in VWF function can lead to bleeding even when VWF levels are normal. Genetic testing can confirm the diagnosis and identify the specific type of VWD. Early diagnosis of VWD is crucial to prevent and manage bleeding episodes effectively. Undiagnosed or poorly managed VWD can lead to significant morbidity and impact quality of life. Heavy menstrual bleeding, for instance, can lead to anemia, fatigue, and reduced quality of life in women. Prompt treatment with VWF replacement therapy or other medications can prevent excessive blood loss and its associated complications. Early identification is particularly important for individuals undergoing surgery or dental procedures. In these situations, prophylactic treatment with VWF concentrates or other hemostatic agents can minimize the risk of excessive bleeding. Moreover, a timely diagnosis allows for patient education and empowers individuals to manage their condition proactively. Understanding their triggers, recognizing early signs of bleeding, and knowing when to seek medical attention are essential for individuals living with VWD. This proactive approach can significantly reduce the fear and anxiety associated with the condition. Living with VWD requires a proactive approach to manage bleeding risks and maintain a good quality of life. Treatment strategies are tailored to the individual's specific type and severity of VWD, as well as their lifestyle and bleeding history. For many individuals with mild VWD, no regular treatment is necessary. However, they should be aware of potential triggers for bleeding and take precautions. Medications such as desmopressin, DDAVP, can be used to stimulate the release of VWF from body stores. This is particularly useful for managing bleeding associated with minor procedures or during menstruation. In cases of more severe VWD or for major surgeries, VWF replacement therapy is the mainstay of treatment. These concentrates derived from plasma donations provide the missing VWF and help control bleeding. With proper management, individuals with VWD can lead healthy, active lives. The field of VWD care is constantly evolving, with ongoing research paving the way for improved diagnosis, treatment, and ultimately, a cure. Current research focuses on developing more convenient and effective treatment options. This includes longer-acting VWF replacement therapies and novel agents that mimic the action of VWF. Gene therapy holds immense promise for a potential cure for VWD. This innovative approach aims to correct the underlying genetic defect responsible for the disease. While still in its early stages, gene therapy has shown encouraging results in clinical trials and offers hope for a future where VWD is no longer a lifelong concern. The development of personalized medicine approaches is another exciting frontier in VWD care. This involves tailoring treatment plans based on an individual's genetic profile, lifestyle, and other factors. The future of VWD care is bright, with continued research and advancements promising a life free from the fear of bleeds for individuals affected by this common yet often overlooked condition.